Sorinum. The therapeutic field of this remedy is found in so-called soric manifestation. The sorinum is a cold medicine. Want the head kept warm. Want warm clothing, even in the summer weather. The sorinum is a cold medicine. It wants warm clothing even in summer season. Extreme sensitiveness to cold. Debility, independent of any organic disease, especially the weakness remaining after acute disease. So sorinum has debility in any organic disease. There is much weakness after acute disease. Lack of reaction, that is phagocyte defective. When well-chosen remedies fail to act, so there is lack of reaction in sorinum. Scrofulous patient, secretions have a filthy smell, profuse sweating, cardiac weakness, skin symptoms are very prominent, often give immunity from cold catching, easy perspiration when walking, syphilis, inherited and tertiary offensive discharge. So therapeutic field is soric manifestation. It is a cold medicine and want to be kept warm. There is a great tendency to catch cold, and it lacks a reaction. That is phagocytes are defective, or when well chosen remedy fails to act, you can give sorinum. So there is profuse sweating with filthy smell of discharges, offensive discharge. Now the mind symptom: hopeless, despair of recovery, melancholy, deep and persistent, religious and suicidal tendency. So it is melancholic, deep and persistent, and the sorry patient is religious, and they have a suicidal tendency. Now the head symptom: awakes at night with pain as from blow on head, chronic headache, hungry during attack with vertigo, hammering pain, brain feels too large, worse change of weather, dull perceived pain in occiput, humid eruptions of the scalp, hair is matted, and dry hair. So the head, there is chronic headache and hunger during the attack with vertigo and hammering pain, brain feels it is too large, and symptoms are worse with change of weather. There is a dull perceived pain in the occiput, and there is humid eruption on the scalp with matted hair and dry hair. And the eye symptoms: agglutinated, blepharitis, chronic ophthalmia that constantly recur. There is chronic ophthalmia which recur constantly, and the edges of the lids are red, and from eyes there is an acrid secretion. So edges of the lid are red. There is chronic ophthalmia that recur constantly, and acrid secretion. Mouth symptom: obstinate rackets at corners, tongue gums ulcerated, tough mucus of foul taste adhered to the soft palate. Nose symptoms: dry coryza with stoppage of nose, chronic catarrh, drooping from the posterior nails, acne rosacea. So there is dry coryza with the stoppage of nose, chronic catarrh and droopings from the posterior nails. Ear symptoms: raw red oozing scabs around the ear. There is oozing scabs around the ear and they are red and raw. Sore pain behind ear. Herpes from temples over ears to cheeks. So from temples to cheeks, it's over the ears to cheeks, there is herpes. Offensive discharge from eczema around the ears. So there is scabs around the ears, and there is offensive discharge from eczema around the ear. Intolerable itching, chronic otorrhea. Most fetid pus from ear, and it is brownish and offensive. So the fetid pus from the ear is brownish and offensive. There is scabs around the ear, which is red and raw, and there is offensive discharge from eczema that is also around the ear. Face: swelling of the upper lip, pale and delicate face. There is humid eruptions on the face and sickly. So the face has a sickly look with swellings on the upper ear. It is pale, very delicate, and there is humid eruption on face. Throat: tonsils greatly swollen, painful swallowing with pain in the ear. So for throat symptoms, tonsils are swollen, and on swallowing there is pain to the ears. Profuse offensive saliva, tough mucus in throat, recurring quinsy, eradicate tendency of quinsy. So sorinum eradicates tendency of quinsy. Hawking of cheese, pea like ball of disgusting smell and taste. So on hawking there will be a cheesy pea like ball, disgusting smell and taste. So the mucus will be like pea like balls with a disgusting smell and taste. Now the stomach symptom: there is irritation like bad very hungry, always must have something to eat in the middle of the night. So he is very always and want to have something to eat in the middle of the night. And there is a irritation which tastes like bad egg, nausea and vomiting of pregnancy, pain in abdomen after eating. Stool: mucus, bloody, excessive fetid, dark fluid. Hard, difficult stool with blood from rectum and burning piles. Constipation in infants, in pale, sickly, scrofulous children. So constipation in infants who are pale, sickly and scrofulous. Females leukorrhea fitted lumpy with much backache and debility. So in females leukorrhea, which is lumpy and fitted, and there is much backache along with leukorrhea. Mammae swollen and painful. Pimples oozing on acrid fluid that burns and excoriates the gland. Respiratory system asthma with dyspnea, worse sitting up, better lying down and keeping arms spread wide apart. So asthma and dyspnea, it is worse sitting up and better by lying down and keeping the arms stretched wide apart. So asthma is better by lying down and keeping the arms stretched wide apart. So there is dry hard cough with faint weakness in the chest, feeling of ulceration under the sternum. So the feeling of ulceration under the sternum, pain in chest, better lying down. Cough returns every winter from the suppressed eruption. Cough returns every winter from suppressed eruption. Hay fever returns irregularly every year. So in respiratory complaints, there is asthma with feeling of ulceration under the sternum, and a cough which returns every winter from suppressed eruption, and a hay fever which returns irregularly every year. Now the extremities, weakness of joint as if they would not hold together, eruption around the fingernails and fitted with sweat. Skin dirty, dingly look, uh, dry, lusterless, rough hair, intolerable itching, herpetic eruption, especially the scalp, bend of joint with itching, worse from warmth of bed. Enlarged glands, sebaceous glands secrete excessively. There's oily skin, intolerant ulcer, slow to heal, eczema behind the ear, crusty eruption all over, urticaria after every exertion, pustules near fingernail. So the skin is dirty, dry, lusterless with rough hair, and there is intolerable itching. The herpetic eruptions can be seen on the scalp, bends of joint with itching, and these eruptions are worse from warmth of bed. The glands are enlarged. The sebaceous gland secretes excessive. There is profuse secretion of the sebaceous gland, which gives the oily appearance to the skin. And indolent ulcer, which are slow to heal. As we have discussed earlier, there is eczema behind the ear and crusty eruption all over. Urticaria after every exertion. After every exertion, the patient may develop urticaria, and there is pustules near the fingernails. Fever, there is profuse offensive perspiration and night sweat. So night sweats can be seen in psoriasis with offensive profuse perspiration. Sleepless from intolerable itching. So because of this intolerable itching, the patient is usually sleepless and easily startled. The modalities are worse from coffee. So psoriasis patients do not improve while using coffee. A worse change of weather in hot sunshine from cold. Dread of freeze, cold air or drought. Better heat, warm clothing even in summer. So they are better by heat, warm clothing in summer, and dread of cold air and drought. Worse from change of weather and in hot sunshine. So worse in hot sunshine, but better in summer and from warm clothing and from heat. Complementary remedy is sulfur. So for the doses, 200 and the higher potency should not be repeated too often. Psoriasis requires something like 9 days before it manifests its action, and even a single dose may elicit other symptoms lasting for weeks. That is agreed. It is called the agreed that the psoriasis requires something like 9 days before it manifests its action, and when a single dose may elicit other symptoms lasting for weeks.